All righty. Good morning, Pagosa. It's Friday, TGIF and all that. And glad you've joined us for Good Morning, Pagosa. We're live at the Pagosa Springs Medical Center today. They've invited me here, and I'm joined by Marcia Nuth and Jake Abbas. Did I pronounce that correctly?
Correct. Exactly.
Oh, good. And hello. Marcia's been on the radio before. Jake, you're new, but do you want to tell us about yourselves just a little bit first and then introduce?
Well, Marcia Nuth.
Yes.
I'm an LCSW here at Pagosa Springs Medical Center.
Yes.
I am here doing what's called integrated behavioral health care, and we are now moving into being full-time in the clinic and having availability, a behavioral health professional available full-time in the clinic. And since that, we have hired Jake, and I'll let him tell you a little more about that. But that now that Jake is here, we are full-time, 100% covering the clinic for those needs.
Because you've been on the radio, I don't know, at least several times.
Yes. Uh-huh.
So it's been several years, at least. 5, 10? Time flies.
I've been here about 11 years.
There you go. So okay, good. That's great. Well, welcome, or thanks for having me here, and it's good to have you on the radio again. Jake, how about you? How'd you get here?
Thank you so much. Yeah, that's a great question. So I'm a very recent Pagosan. I've been here about 3 months now, going on my 4th month here, and moved out here with my family to be a part of this Pagosa Springs Medical Center integrated community.
Yes.
And so I'm a licensed professional counselor, which is very similar to a licensed clinical social worker, which is what Marcia is.
LCSW, LPC. That's it. Okay.
Correct. Yeah. So that's my
licensed
distinction. We do a lot of the same things.
Counselor?
Correct. Exactly.
Okay.
Yeah.
LPC. So what does that mean exactly?
So I provide a lot of therapy for people, behavioral health and substance use therapy. So when I say behavioral health, think of like depression, anxiety, post-traumatic stress disorder, ADHD, those types of things. And then substance use treatment, people who are struggling with, misuse of alcohol or drugs and things like that.
That's just in the news all the time.
Yes, it is.
Problems, yeah. So that's great that you're here. Just another wonderful addition to the hospital here. Marcia, good work.
She did help.
I'm not sure how much I was a part of it, but I did get an opportunity to choose him. And one of the reasons that, a couple of reasons why we chose Jake is one, he does have what's called a licensed addiction counseling. So he has that highest specialty in addition to his therapy background. And to really kind of meet that need also as well in the clinic.
Very good. LAC, all these acronyms, right?
Right.
We don't make it easy on
you guys
people
are like
always.
banks with all these. But that's really helpful. So LAC, licensed addiction counseling.
Correct. And so, you could go to a licensed professional counselor or a licensed clinical social worker, those LPCs and LCSWs, to get addictions treatment as well. With a licensed addiction counselor, there's some specialization and some classes that we take and some supervision that we receive in, specific tactics for helping people who are struggling with substance use.
So so is Pagosa any different than where you came from, Chicago? Or I mean, obviously it's very different, but similar problems. I mean, similar things that go on.
That's a great question. So I'm coming from Denver. I spent the last 7 or 8 years in Denver and working in the field. And I will say that the problem is pervasive throughout Colorado. Substance use problems. One of the differences about Archuleta County in particular is I think we have a little bit less data on substance use, and I think that owes to us being more of a rural community, more of a smaller community. So I think. We kind of are fighting a little bit of a thing in the shadows now in Archuleta County. So I think we would benefit from getting more data, but I do think we have a lot of really qualified professionals that can help you, including here at the hospital.
Including you guys, yes. Right. So that's fantastic. I mean,
well, let me tell you
yes.
how that's going to play in with integrated care that we're doing here. And usually every year when I'm on here, I do kind of re-explain integrated care. And integrated care is the putting together the physical health with the mental health or behavioral health, whichever one you want.
So if you go to the primary care clinic, they have a questionnaire for you, right?
Exactly, the questionnaire. I'll talk more about that too. Mm-hmm. So and let me tell you the reasoning for this. Or one of the reasons is there's a lot of research out there stating that to just address the physical care is not enough any longer. Yeah. And that, in some of the research is anywhere from 30 to 60% increase in health outcomes when you address somebody's mental health. So an example is somebody comes in for diabetes, chronic illness, pain. Medical provider through their treatment can have maybe improvements anywhere from 30 to 60%. However, when you address the mental health or the behavioral health, you're looking at a higher income, higher return on a person's quality of life. Yes. So then you're looking at, okay, this 30% now jumps to 60 to 80% because of the connection between behavioral health and physical health. So part of that also comes our substance abuse. And the place that also comes in is, and we talked about, the questionnaire. So we have moved to doing a questionnaire for depression, a scale for depression, and for suicide on every patient every time. Yeah. And so this only takes a minute or two. You're usually doing this when you're waiting for your medical provider to come in. And then based on those scores, that may prompt a referral in the moment to either Jake or I that it's available to come in and talk to someone about that. So that catches stress early before it becomes maybe a mental health crisis. It also gives us an opportunity to see where substance abuse does play there. And with the suicide piece, we're trying to catch maybe those thoughts that haven't gone far enough to where somebody's going to act on them. Yes. Right. And so this is all about early intervention and improving the quality of somebody's life through health.
Yeah, and the integrated part, it just implies teamwork, the hospital team working together on helping patients with all these needs.
Yeah, absolutely.
Definitely.
So,
and we can talk more. Jake, you can talk more about maybe even the suicide piece on why we are addressing that every patient every time.
It does seem that's a high number for these rural parts of Colorado. I don't know. 100%. Just that's my impression.
No, and I think your impression is exactly right, and particularly in our part of the country, the Mountain West is particularly susceptible to, high numbers for suicide. And, it can be a really tough thing to talk about. Both for, people that we love and care about, and us as professionals. We really have a hard time, dealing with loss and the potential for suicide. And you are exactly right that Archuleta County, does have unique concerns for suicide. Our rural nature, our kind of the things that we all love about Pagosa Springs are also what kind of make it a little bit tough for suicide. That we enjoy our free will and our open spaces and things like that, but those can keep us siloed from each other sometimes.
Yeah. Loneliness, maybe, or isolation,
100%.
Things like that work into it.
And one thing I'll say is one great protective factor that I've noticed in Pagosa Springs is people check on each other here.
Yes, very true.
And I'm sure you two have seen that a lot more than I have in 3 months. But even in that short amount of time, I've noticed that. And one thing, people ask us a lot of advice and things like that for their loved ones when it comes to behavioral health or substance use. And that's, the most basic advice I can kind of give to people for your loved ones is and even your neighbors and people you just might know casually, is to make sure you're checking in on them, and even just a warm phone call. I've heard from patients that have attempted suicide before, and they have said, somebody reaching out to me, somebody just saying, "Hey, how are you?" would have meant so much to me. And I'm not saying it would have changed a lot, but it would have definitely made me feel more loved and cared about in the moment. So yeah, I definitely think that is one of the biggest reasons why we do screen every patient for suicidality and if they're having any thoughts of self-harm or anything like that.
And this form, where does it come from? Is it a mandated thing by the state, or did the hospital come up with it here? Or,
yeah,
is it customized for our community? That kind of thing.
It is actually a very widely used form in behavioral health. Marcia came prepared today.
Wow,
she actually brought a copy of it. She's the best. It's called the Columbia Suicide Severity Rating Scale, and it's a very short questionnaire. I believe it's 7 questions, right?
Yes.
And so people will get that. It isn't necessarily catered to our community. It's written in a way that can kind of apply to anybody throughout the country, so that we all have uniform, and that's why I brought up data a little bit ago too, so that we all have uniform kind of methods for doing this and collecting data.
Yeah, the benchmarks and that. Yes,
exactly.
What so there's 7
There's
questions?
7 questions,
yeah.
And I do want to address that because I know there's a fear sometimes about being truthful on these scales, and we have people that come in and have what we call passive suicide. And one of the questions is, do you feel like ever you don't want to wake up, or you want to go sleep and not wake up? And that doesn't have a suicide plan or intent, but you'd be surprised on how many people actually are positive for that. And so that does not get you, locked up or some big people coming in and taking you away.
Yes.
We don't do that unless it's in the severe cases. So saying yes to that just gets you maybe a call from us, or in the moment, if the provider decides that we, need to come in, or the patient wants us to see us, then we'll come in. And then that's that early intervention piece where you can really reach somebody when they're in stress or they're just having a bad time in their life, to where they would say that before it gets too far. And then what we do when we come in on that piece is we offer either therapy with ourselves or with anyone else in the community. Or it just may be that we give you some skills right there in the moment, and that's all that's needed. So it doesn't always equal some kind of long-term kind of therapy or treatment. A lot of times we can see people just for a few visits and just get them through a rough time.
And if it's gone to a certain, depth or whatever, they could be in a denial phase too, maybe, like denying there's any problem at all, or does that get around? Do the questions get around that, or is that more in, substance abuse problems and
That's
things like that?
That's more of a substance abuse, I feel.
That sounds right.
These questions are pretty direct. The new research is that you ask the question and you ask it directly. And so, I'll let you know that just in case you ever have a family member or someone else, is you just ask them, are you having thoughts?
And I think you've probably had this experience too, where you sometimes will see the relief in someone's face and their shoulders drop, where it's just like, oh, we can talk about this. This is a safe space where I can, I've been keeping this from people for sometimes decades, often decades. And so, that is one of the biggest things I think I offer and Marcia offers, is the chance to talk about some of these things that have no air to talk about anywhere else in our lives,
And when it's gone on for that length of time, it's probably hard to unwind the situation too. Yeah. So that's a commitment to try to, make someone better.
Totally.
Yeah.
Wow, that's a tough job. You guys are amazing that you
Well, I
try
think
to do
we're both
this.
pretty passionate
Yes, I can tell.
being in the clinic, being available to people in Pagosa. I'm passionate about serving this community. And so in a behavioral health capacity. Yeah. And so I have been excited about having full-time coverage and I will tell you that if, you come in and you haven't screened positive on any of this and you're having something very stressful in your life, you can ask your provider to see one of us, a behavioral health professional. And as of now, your first consult is not billed. It is free of charge at Pagosa Springs Medical Center. It is only if you choose to do longer treatment to where we bill just like any other professional would. So,
fantastic, yeah. And we're here at the Pagosa Springs Medical Center today. Good morning, Pagosa. And Marcia Newth and Jake Abbas are kind enough to be here on the radio. Marcia is an LCSW, and Jake is LPC, LAC. So you can be sure to, call the hospital if you need their assistance, or talk to your primary care person. And the clinic's amazing here, by the way. But we're going to take a quick break, and then we'll just wrap it up. Maybe. How's that sound? Okay.
Great.
So thanks to our sponsors for bringing us Good Morning Pagosa on this beautiful Friday morning. A little chilly, but it's okay. Get some snow in the mountains, and the ski area has been open for a while, so that's always a nice thing. And we'll be right back. Okay, we're back at the beautiful and awesome Pagosa Springs Medical Center live for your Friday Good Morning Pagosa. And just want to mention that the Pagosa Springs Medical Center Foundation is having its 6th annual wreath auction, and that starts today. It benefits the Center for Cancer and Blood Disorders, and it's already started just this hour. The wreath auction will end at 1 p.m. on Wednesday, December 4th. The PSMC employees have created the wreaths, and you can bid on them in person or on PSMC's Facebook event page. Get your one-of-a-kind wreath for the holidays at PSMC. And also looking ahead to another educational talk, meet and greet, brought to you by the Pagosa Springs Medical Center. It'll be at the Liberty Theater downtown at 418 Pagosa Street, Tuesday, December 3rd, featuring Barry Holcomb, MD, Pulmonary Critical Care. Another new doc here at Pagosa Springs Medical Center. That's Tuesday, December 3rd at the Liberty Theater, 5:30 to 7 p.m. It's a free event. And you can always RSVP to 970-507-3811 or email Jody, that's JODI.SCARPA at psmedicalcenter.org. And now we'll get to our part 2 of the show here live at Pagosa Springs Medical Center. How we doing so far, you guys? Jake, Marcia?
We're feeling real good this morning.
Good. Excellent. Well, I'm so glad you invited me over here, and I've learned a lot here myself, and I hope our listeners have too. Is there anything we haven't discussed that you want to cover, or as far as behavioral health goes here in our community and at the hospital?
The other thing we wanted to cover is this idea, of therapy in general, and particularly long-term therapy. We see on TV a lot, somebody's laying reclined in a couch while there's a professor smoking a pipe on the chair, and I guess maybe in some settings that's the way it is, but I think it would be helpful to kind of draw a distinction between what Marcia described with the integrated behavioral health and what more traditional therapy would look like. It is important to know that we do offer, long-term, solution-focused, brief therapy at the hospital. I think that's a really cool thing. That's one of the reasons that I wanted to take this job. Is it's a unique opportunity to provide, in the moment services while also having clients and people that you see weekly, biweekly, monthly. I think therapy can be a lot of different things. It can be skills-based. It could be more solution-based, where we kind of talk about, here's the problem, how can we navigate through that problem and come to a conclusion. It can also just be someone to talk to. I think especially this time of year around the holidays, there's a lot of, stressful events that come up. There's a lot of great events too, but there's a lot of stressful events. And sometimes it can feel very isolating this time of year, especially in Pagosa with the winter. Sure. So I think it's really important to find your people that you can talk to. For some people, it might not be a therapist. Some people that might not be appropriate for them. But if you do feel like you are wanting to either build some more skills, talk about some stressful things in your life, or just have someone that you can kind of process what your life is like at this time, I really think it's a good idea to either come down to the hospital, the medical center, or search out resources yourself. Or one thing I'll say too is we can help people find therapists in the community here at the hospital, even if we didn't have the capacity to help them. We have Marcia has a very exhaustive list of all the therapists in town and stuff, and so we're happy to help. We just want people to find the right place, even if it isn't the hospital.
So you mentioned skills. These are skills of positivity, or just
sure,
being, working on feeling better, I guess.
Sure.
Mentally.
Sure. I can actually do just the quickest skill right now for anybody that's listening. It's called square breathing, and you breathe in for about 4 seconds, and then you hold that breath for about 4 seconds, and then you breathe out for about 4 seconds. This regulates your central nervous system. It helps slow down your heart rate. It can be really great for anxiety or even just focus. Yes. So that's like the simplest version of a coping skill.
Fantastic. Yeah.
But that's the kind of thing that we could help you with if you were having panic or anxiety or something like that.
And there's plenty of that in this world these days, right? Well, thank you so much. Marcia, anything else?
Well, I just want to add I want to give a little plug for our community support specialist. It's a new position here. I have been multitasking, doing some of that in addition to behavioral health. And so Yen has been great about really knowing all the resources here. Between the two of us, we are quite versed at any resources, whether it's a behavioral health therapist or just you're struggling with basic needs. And so I'd encourage you to reach out to the hospital, ask for myself or Yen, because we can help in that way too. Because we know if your basic needs are not being met, that is definitely a source of stress.
Yes.
So.
Very good. All right. Well, thank you guys so much.
Thank you.
Appreciate your time this morning and all year round. You guys are awesome. And our hospital, we're so proud of our hospital.
Yeah, thanks for coming.
Yes, you bet. And so that's about it. If you want to call the hospital, it's 970-731-3700. And it's on South Pagosa Boulevard. If you don't just moved here or whatever, you're visiting. I mean, all kinds of things, right? So we're so lucky to have you guys. Thank you so much, and have a great weekend. We'll